Hello, my name's Lisa. I'm a writer and a mental health campaigner, and I'm here to talk to you about NHS Change Day and our Time to Change campaign. I've had a 41-year career in the NHS, first of all as a nurse and then as a manager, and my last 13 years were spent running mental health services. I was the chief executive. I'm also an NHS patient. I first saw a psychiatrist when I was 15, but it wasn't until just over a year ago, the end of 2013, that I decided to come out and talk about that for the first time. And it was very interesting to see people's reactions. Lots of people were wonderful, and they said very kind things and how important it was that I had talked about my own experience of mental illness. Some people said I was brave. That's sometimes NHS speak for foolish. And then there were a small number of people who I listened to rather too much, who said things like, "There you are, we always knew there was something the matter with you." And some who said, "You're just using this as an excuse for why you've made mistakes during your career." The fact is, we all make mistakes sometimes in our careers. The key thing is to learn from those mistakes. But those messages, people who have mental health services, we listen to them. And so that's why I'm here today talking about the Time to Change campaign in the NHS. Time to Change is a national campaign. It's been running since 2007. It's a joint project between Mind and Rethink, two very effective national mental health charities. It's been supported by Comic Relief and the Big Lottery, and it gets funding these days from the Department of Health and NHS England. And they work with large organisations nationally, but also local organisations, including employers, to help to change attitudes and also make sure people have good experiences at work and can make a contribution. They also do important social measurements, and what they've been able to prove is that since 2007 there has been a significant measurable change in public attitudes towards people like me who use mental health services, a positive change, which is really fantastic. But less positive are the measurements that have been made of people who use mental health services, of their experience within the NHS. And that's shown through the measurements that Time to Change have done, talking directly with patients, that they've seen little, if any, change, and in some cases a worsening of attitudes of staff towards people who use mental health services. And that's why we are running our campaign. This campaign is all about changing attitudes within the NHS to make things better for patients and for staff. You can read about the campaign. It's aimed at individuals, at teams and departments, but also at whole organisations. And you can sign up for any of the actions that we've got on the website, or you can come up with your own actions. It's entirely up to you. It's voluntary, it's bottom up, but it's also organisational if you want it to be so. And what we're going to be doing over the next year through Time to Change is working with a number of organisations very closely to see the change in attitudes that such work can achieve. I'm going to tell you a brief story now about myself. I experience depression off and on. I'm on treatment at the moment, but I'm going to go back to in my early 20s when I was going through a very difficult time, and I took a significant overdose, and I was taken by ambulance unconscious to hospital, to A&E, and I woke up having my stomach washed out in accident and emergency department, which is where that sort of work happens these days. And the nurse who was carrying out the treatment said some things to me which I held in my mind for a very long time, and perhaps had an influence on why it was that I didn't tell anybody about my experiences until very recently. So what he said was, as he was washing out my stomach and I was vomiting copiously into a bucket, was, "You are taking me away from looking after people who are really ill. You're very selfish, you're a waste of space, and you really shouldn't be here, and I shouldn't be having to look after you." Now those words I couldn't respond to because I had a tube down my throat and I was being sick, but had I been able to respond, I would have agreed with him, because I certainly felt like a waste of space and selfish, and there being no point to me being there. Now I know that many people's experience of mental health and mental health care and mental illness support is very different from that these days, but clearly it's not different enough, because of what people are telling the Time to Change reporters who've done the research. So what I would like to say to all of you is, please think very carefully about the impact of stigma in your services. I'll just give you some examples of what effect stigma has. It affects the way that people receive their care, the compassion that is given to them. It affects the kind of care that they get, whether they get the right treatment or not. It affects whether they get their treatment in a timely fashion. Do they have to wait for a long time, for example, for a talking therapy? It affects the funding that is allocated to mental health services. We know that it's not enough funding. One of the reasons I'm campaigning is because I want to see more proportion of the NHS funding going into mental health services. It's a really good investment. We also know that not enough money is spent on mental health research, so we're not bringing in new treatments fast enough. We also know that the impact affects not only patients but also the staff who work in services, who are sometimes blamed for things going wrong that are not their fault, or blamed for not providing a care or treatment that is not commissioned. So the effects are significant and they are invidious, and we need to make a difference to those. 1 in 4 people watching this video will, like me, have experience of needing help with their mental health from time to time. 4 in 4 of you will work with somebody who has experience of needing help with their mental health. Wouldn't it be great if, instead of hiding it away, people felt encouraged and supported to talk about these things as part of their day-to-day work, and were seen as attributes in teams, as I believe they truly are. NHS Change Day 2015 gives us a wonderful opportunity to set the Time to Change programme going in the NHS. Please join our campaign. Thank you.